I believe we are sitting at just over 150 students at this time. We have, I believe, 12 employees that have been transitioned to the quarantine protocol as well. 3 elementary schools impacted at this time and 1 high school.
Anything new today other than the emails that you sent over the weekend?
Nothing new today. We just want to continue to encourage our students, parents, and employees to follow the health and safety protocols that have been shared not only by the school district, but the Department of Health, the CDC. We all have a part to play in mitigating risk and preventing the spread of illness. The school district takes this very seriously. The health and safety of students and staff is our top priority, but we need our parents and our students and our employees to be mindful of their symptoms and to not, students should not be coming to school, employees should not be coming to work if they're experiencing symptoms of illness or if someone in their home is awaiting test results or is tested positive for COVID-19.
What is the district policy right now? Because we've been getting a lot of questions from people about what are these symptoms? Is it the common cold or is it actual coronavirus symptoms?
So we have a daily health screening tool that we've put out to our parents that was developed in partnership with the Florida Department of Health in Martin County and our K-12 pandemic response team. That document we ask parents to review with their child every day. It has symptoms listed on it that are the symptoms that the health department has advised are the symptoms commonly associated with pediatric cases of COVID-19. So when parents look at those symptoms and they say, maybe my child has one of these or they're not feeling well, err on the side of caution, keep them home, consult your healthcare provider.
Are masks 100% required in the school building, in the classroom? Has any changes been made? Because we are hearing that some teachers, it's up to their discretion. If social distancing is possible, that a student may be able to take it off. Is that still in place, or how's that stand?
So all students and employees, visitors to campus are required to have a mask on them at all times that social distancing isn't possible. There are specific situations, and this is addressed in the frequently asked questions on our website, where if social distancing can be accomplished, maybe students are sitting in a classroom where the desks are 6 feet or more apart. The teacher does have the discretion to allow them to take off their mask at that time, but any time that a student gets up to move about the classroom, or the teacher moves about the classroom, the masks would have to go back on. We also allow students at recess to have their masks off when they're participating in physical exercise, as well as the shortest possible time when they're eating and drinking for meal times.
Has there been any talk about maybe looking to change that or to update that policy with the growing number of students in quarantine?
The mask policy, we've made it as strict as possible to protect students and staff. We follow the guidance given to us by public health officials. The instances where masks can be removed on campuses for those specific times I mentioned are in accordance with guidelines from public health officials.
After the first couple of days of school now, we're starting almost that second week. Have you found attendance this week on Monday, more parents maybe are shifting back to the virtual because of the number of students that have been in quarantine?
I won't have the attendance for this week, for today or anything just yet. But what we do want parents to know is, again, we don't take any chances. If you feel that your child might be experiencing symptoms of illness, you keep them home. That's why the remote learning option is there. You can transition to remote learning, stream the lessons from home. We don't want anyone to report to school if there's even a chance that they might be feeling ill.
Is there concern among the district with that number kind of jumping up so high over the past couple of days?
Naturally, we don't want any of our students or employees to be exhibiting symptoms of illness. We want everyone to be healthy and safe, but at the same time, we know that there is a pandemic out there, and our job is to continue working with public health experts to mitigate risk to the best of our ability.
I know that the superintendent has said, obviously, that in-classroom instruction is the best option for kids, where they're be getting the proper education, everything like that. If the number of quarantine gets to a certain level, is there any discussion about transitioning to full-time virtual at all?
That's not something that has been discussed at present, but we are in constant communication with public health officials, the health department, local physicians, and the community that serve on our pandemic response team. Our school board and our superintendent are thoroughly invested in protecting the health and safety of students and staff. So if we get guidance that maybe warrants that, we will definitely look at all options on the table to protect students and staff.
But there's no set bar, like it has to be 300 students, nothing like that. That's a set guideline.
We have a criteria matrix that has been board approved, that was developed with our pandemic response team, that discusses the transitioning of classrooms and schools, but nothing for the whole district at this point.
Are you able to share any of that information?
The criteria that's available on our website, I believe it would be like a positive case or a presumptive positive case per classroom could transition the classroom. I don't have the other thresholds memorized, but they are available for parents in the community to review on our website.
Anything else that you could add after the first couple of days of school with the growing number of students and teachers in quarantine?
We are so proud of our students and staff who have reported back to school, and also those doing remote learning from home that are doing their part, following the guidance about public health and trying to keep themselves and others safe. And we just ask our parents to continue to be patient with us. We do have the policies and protocols in place that the health department and physicians and the CDC have recommended will help us mitigate the risk to the best of our ability. And we're proud to be back educating students.
When we chatted with you guys on Friday, it was Hope Sound Elementary, and then over the weekend, obviously South Fork High School and I forget the other school, but that all
Correct.
came out. How did that come? How did that information become known to you guys, and why did it come out over the weekend, not Friday? What was the timeline there?
So J.D. Parker Elementary School is the elementary school that we received notice of the weekend. The reason that did not come out during the school week is that involved employees experiencing symptoms of illness. Those employees actually started experiencing their symptoms of illness over the weekend. So once we got confirmation from the health department that the protocol needed to begin, we immediately took action. Same with South Fork High School. We work with the health department on a daily basis, and when they advise us that we need to take action on a situation, we immediately start taking the action that they recommend. I didn't hear that because of the car.
Anything else at all?
I don't think so. You know, we appreciate everybody's patience as we start this new school year, and we're working hard to keep our students and employees safe.
Perfect. Thank you for taking the time to
Just stay there for a second. I want to get some.
Okay.
Yeah, I wasn't sure if there was like a certain set number that, I mean, because you said now we're a little over 100. If it gets to like 500, is that when you guys start having talks about transitioning back?
And that's something, we take all of our guidance about these transitions from the health department.
Okay.
So I know that the situation and the guidance that they are receiving probably from the state level health department is evolving, you know, and we're taking it as it comes to us. Everything that they've recommended that we do, we are doing it. We're in the business of educating kids, but they're the public health experts, so.
On Friday, the superintendent said that she expected, obviously, a certain number of classrooms and students to be in quarantine. Has this now risen to the level where you didn't expect it to be this high?
I don't think that anybody could have put a number on the number of cases. I mean, we know that Florida is experiencing a high number of cases in the state, specifically compared to other states maybe throughout the nation. I don't want to say that we expected a certain number or didn't expect a certain number, but we knew that this was a very real possibility that we've been preparing for with the health department.